Everyone, let me welcome all my viewers once again today on Beyond Sugar. As you are aware, Beyond Sugar is created for all of you, and it's always great to be connecting with you on these live programs. Not only we share with you on a daily basis content related to diabetes and its complications so that you can manage your health in a good way, but also for you we invite leading doctors from across the country who can talk to you directly as a friend on the topics on which you want to listen and you have queries. I'm very glad to welcome today Dr. Ipsita Ghosh from the city of Kolkata. Ma'am, welcome to the program.
Thank you.
We hear a lot of chat and a lot of questions from our viewers, and people want to understand different diet patterns, and something in this which is very commonly asked is about intermittent fasting. So today we will use, ma'am, your expertise to talk about intermittent fasting. Does it help in various situations? In which situations it helps? But before taking questions from the audience, let me formally introduce ma'am. She is one of the leading endocrinologists from the city of Kolkata. After doing her initial graduation and master's in medicine from Kolkata, she did her DM in endocrinology from IPG, MER, and SSKM Hospital, the prestigious institution of our country, and she did her DM from there in 2018. And now, for last 6 years, she is serving her patients. She has a dozen of publications and in medical journals and various academic awards. Currently, she is consultant endocrinologist at EEDF Hospital in Kolkata, as well as she visits Narayana Super Speciality Hospital in Howrah. She has also joined as faculty at Ramakrishna Mission Shiva Pratishthan, another prestigious academic body in the city of Kolkata. With this, ma'am, I straight away hand it over to you for your opening remarks on this topic, and then we will take in the questions from the audience.
So, good evening, all. Good evening, all my viewers. I'll be talking about today's intermittent fasting. This is something which is very interesting because this topic has been somewhat very prevalent for a few years now because of the rising number of patients who are obese and also huge number of patients suffering from PCO. These are the ideal patients in which we can at least start on with intermittent fasting because it's somewhat very easy to follow. It can be done in various mechanisms, like various formulations can be prescribed according to the patient's situation or patient's history. So, very simple example is just prolonging your overnight fast. I would say that this is one of the easiest way of starting your diet, and but we need some supervision from your healthcare professional because I wouldn't suggest that each and any patient can take up intermittent fasting, but those who do not have any complications or comorbidities can easily go ahead with intermittent fasting under supervision. So
All right. Yeah, thank you for sharing your opening comments. All of us have heard about fasting. Fasting is an integral part of Indian culture, and we have seen for ages in our in families also people doing fast on various occasions. But help us understand what is this intermittent fasting. These are some new fancy terms, and help my viewers understand what is intermittent fasting. How is it different than the routine fasting which people do, so that we understand to begin with what it is all
yes.
about.
So, as you have mentioned that we coming from India, we have huge diversities in our religion, and we actually perform some religious fasting as well. It's something which is known to us for millions of years, and we know it doesn't cause any harm to those patients who are absolutely normal without any comorbidities. So, if I have to talk about intermittent fasting, it's the thing that is important is when you're eating. It's not that what you're eating, so the time frame is very important. So it's a form of fasting. It's not calorie restriction or starvation. So starvation means you go along ketosis, and that's actually very harmful to the body. And calorie restriction also can cause nutritional deficiency. So in this intermittent fasting, what you do is you are restricting the time when you're eating, and when you're eating your whole food at that point of time. You're taking in all the calories that you want to take. So it's time restricted. That is number one. Secondly, what is important is that is voluntary. So this is something which is your own decision taking, is something which is in your hand. So you can do number of intermittent fasting, that is say alternate day fasting, that is one day you're eating and the other day you're fasting. Then there is 5 is to 2 calorie restriction, that is 25% of your calorie consumption is on 2 days of a week, and 5 days you're without you're taking the 75% of your calorie intake, which is normal diet. Then you have a detox manner, that is like Ramadan fasting, that you are doing fasting for say 1 month. Then most important and most popular one is the commonly practiced one is the time restricted, that is 12 12, 14 10, and 16 8, in which 8 hours you're taking your meal and 16 hours you're fasting. So it's a form of, I would say, an enhancement of your ketogenic diet. So your body fat is being burnt, and also the other thing that I have to say in medical term is autophagy. That is, your body is given time to rest. So your metabolism increases at that point of time, because we have a healthy microbiome, that is the gut microbiome or the good bacteria, which is around 1.5 liters in the body. Now they should not be given food all the time. They need time to rest. So that is good microbiome or good gut microbiome is essential for many chronic disease. So even diabetes, obesity, cancer, everything is related to gut microbiome. So a period of fasting is actually required. So I would suggest my patients or those who are listening to me today that late night snacking, late nights or intermittent snacking even after dinner is something I would ask my patient to avoid, just to give your gut a little bit of rest. That is a form of intermittent fasting. So intermittent fasting is actually safe and can be done under medical supervision.
Okay. So essentially, what you are saying is that there is no restriction on what you eat. An individual can eat anything, but then this is time restricted. That means that over a 24-hour days schedule, you, let's say, eat for 8 hours or 10 hours, and then don't eat anything for 14 hours.
And you can take fluid, as much fluid you want. So it's not
Okay.
starvation. You can take fluid. So
So while
in
you
the,
are not
the
eating,
period of
so you
fasting,
can
yes.
take water. But why do we do this? I mean, what's the purpose and objective of this? You can, as a routine, as come, let's say, if someone has to reduce weight and do diet, so there are other options available, like you reduce the calorie intake and you make small meals over a period of time. But then, how does it help? What is the objective of intermittent fasting? And is it better
So
than the other ways of fasting?
all kind of diet has got some side effect, and most of it which is important is adherence. Adherence is the biggest issue. So for example, if you want to lose weight, we go to a dietitian for a crash diet. So we do it for 1 month, and later on we can't follow because of the you lack the energy, you lack micronutrients, like there might be some amount of micronutrient deficiencies. So these are not advisable for a long run. But intermittent fasting is only, say, a little bit prolongation of your overnight fasting. So you're already sleeping for 6 8 hours and you're not eating for 2 hours more, so 10 hours you're already on fasting. So I'm just asking you to increase for 2 hours more or 4 hours more. But what it does is, it's, as I mentioned, it's not calorie restriction, it's time restriction. So during the period of no feeding or start or fasting, what happens is your body's internal fat, it starts burning. So you're reducing your the amount of fat that you have in your body. Along with that, there is a decrease in the insulin secretion. Along with that, a decrease in the sugar levels as well. Improvement in the inflammatory status, the inflammatory markers also reduces. Then we have this weight loss because of the internal fat burning. We have an improvement in the lipid profile. We have seen to have an improvement in the blood pressure levels. Even those who are on anti-lipid or statins or antihypertensive agents. We ask patient to go for a regular follow-up because these improvements are seen. And not only that, the because it's not calorie restriction, the stress hormones are normal. So and also there is no refeeding syndrome, because those who are starving usually have huge amount of hunger, and they try to eat a lot during the refeeding period, and they gain in weight again. So in this, the prolongation of overnight fast will not cause this refeeding syndrome. So the chances of gaining that weight is also quite less. That I would say compared to starving a patient with a crash diet or something like that. And what is important is your body is getting the rest, your gut is getting the rest. The word I mentioned, the gut microbiome or the good bacteria, they are also getting the rest. And what they do is during this period of getting rest, they undergo a term that we say autophagy. That is, the weak cells are taken up by the body and destroyed. So this is not done on this is something which is not prevalent when we are eating a lot or we are eating throughout the day. So it happens only when we are fasting. We are getting our body a little bit of rest from eating. So autophagy is something which is very important, especially we have found to have some amount of importance in cancer, in type 2 diabetes, in Alzheimer's disease. So fasting is actually good for health.
Okay. So don't worry about the few technical terms which she mentioned, but
Yes.
I think the simple message for all of you is that it is helpful, and fasting is normal. I think in our system we have been doing fasting in one way or another since childhood. But then intermittent fasting, the way she explained, is not restricting your food but restricting the timelines when you take that food, and there are significant benefits, as Dr. Ipsita mentioned. And one of the important benefits she mentioned is that since you are there is a rebound effect also may not happen, which may happen with a lot of other ways of fasting. So while, ma'am, you have, let's say, made a very compelling case for intermittent fasting, then who are the right kind of individuals who may be benefited, or as a doctor, to what kind of people you recommend intermittent fasting and for what purposes?
Right. Uh, Mainly those patients who are obese. That's number one. Overweight patients or obese patient, we can start on with intermittent fasting for a first few months to see whether it's effective in these patients or not. Because obesity is actually a disease. It's just like a thermostat. If you stop your medication or you stop your diet or you stop your exercise, you will go back to the same old weight. So you need to do something which you can continue, and intermittent fasting is something that you can continue for a while. So this is something we usually prescribe or ask our patient to follow, especially those who are obese and overweight. And second most important are PCO patients. PCOD, these patients are also overweight. Their lifestyle is not that good because they take in loads of junk, and they continue this intermittent nighttime snacking is something which is very deleterious, especially to our younger generation, because they are the ones who stay awake at night and keep on munching. Diabetic individual, we usually suggest them if they are not on oral hypoglycemic drugs. But even there, we don't suggest them to go for a stricter 16/8 or 1 day alternate fasting. We usually tell our patient that 12-hour fasting is more than enough, especially in those patients in which we are trying to induce weight loss. Those are the ideal patient in which we should start on with intermittent fasting.
Okay, all right. So I think so. This is helpful for our viewers, and I think now you can understand that what is an intermittent fasting, in what kind of individuals it can be helpful. But I have an intriguing question, ma'am, to you, and that's like all our lives, in these years we have heard diabetologists telling to the patients that take small meals, be disciplined in your life, small meals and multiple meals at right durations. But what you are saying now is very absolutely contrary, like this intermittent fasting. So how does it help a diabetic patient reduce his, let's say, blood sugar levels? That is number one. And secondly, would it lead to any kind of side effects like hypoglycemia or those things, and would it require any adjustment of the medicines also if you are giving it to a diabetic patient?
So I haven't contraindicated my the lines that I've mentioned. That small frequent meals we don't ask our patient to eat at night. So small frequent meals is something we say that three major meals and three snacks in between, two or three snacks in between. So we start our breakfast at 8 and we finish off our dinner by 8. So this can be done in a diabetic patient. But I wouldn't suggest my patient to start their breakfast at 12 and finish off by 8 at the night, because in these individuals it's very difficult to monitor the patients, because these patients, we always say that a drug diet imbalance is the major reason. Drug diet imbalance meaning that the patient is taking the medicines and not eating properly. That is the major reason we have hypoglycemias. So I would suggest these individuals who are on diabetic drug to start on with intermittent fasting 16 8 hours. I can say that you can continue for 12 to 12 hours, because I'm not restricting the calories here in intermittent fasting. The patient is taking all kinds of food in between. So this can be done in diabetic individual. Obviously we need to know about the glycemic index, like what food will increase how much of glucose and which needs to be avoided, needs to be the patient needs to be informed. So these patients can know what they want to take and when they want to take, but they can do a 12 to 12 hour fasting. Regarding the amount of sugar level that can go down and go up with every meal is the reason why we say that you go for small frequent feeding. Because if you only take breakfast, lunch and dinner and nothing in between, we can have dips like hypoglycemias. And when we are going to have our next lunch or dinner, the hunger pangs are huge, so we tend to take too much of meals, and for that reason we have hypoglycemias and hyperglycemias in diabetes. So if we train our patient to take small frequent meals, that is snacks in between two meals, two major meals, then what will happen, the hypoglycemias will not happen first. And secondly, when we go for a lunch or dinner, we don't feel that hunger, so the amount of intake is also less, so the glycemic variability is maintained in diabetic individuals. So ups and downs are not there in diabetic individuals if we go for small frequent meals, but we can safely go for 12 to 12 hour fasting. Now, regarding the second part of the question, whether we need to reduce our sugar medicines or not, obviously yes, because first 3 months is the precarious time. We need to monitor very closely. Even if we can say, if even we can if we can go through the diet of the patient who we are attending to, a diabetic patient, we can see there are huge number of discrepancy in their diet. So we need to modify their diets as well. And lifestyle is the major reason we are having diabetes or an uncontrolled diabetes. So if we can modify the diet, then the best way to control diabetes is there. So intermittent fasting, we possibly should reduce the dose of anti-diabetic agent. Not only anti-diabetic agent, we have to reduce the statin dose as well, and also the antihypertensive as well, because intermittent fasting is actually good in every aspect. So there are studies in mice, there are studies on humans, crossover studies are there in which time restricted intermittent fasting has been looked into, and we have seen that there is an improvement in the lipid profile, in pressure levels as well. Maximum reduction is by 10. So that's kind of huge for those who are on antihypertensive agents. So all these three chronic disease is actually improved with fasting.
All right. So you can, adopt this method if your doctor is recommending, and it's pretty safe, as Dr. Ipsita highlighted to us. And at the same time, like if you have an underlying disease, if you have diabetes already, then it's preferable that take it with your under your doctor's supervision, because this may require some kind of adjustment of your medicine. And as a good benefit also of intermittent fasting, the medicine doses may come down, which is again, can be done by your doctor. Ma'am, this is for those people who have, let's say, an underlying disease like diabetes or hypertension or already under medical supervision. But let's say, if someone is not having diabetes, a normal person, but just overweight or in the obese category, so does he or she also needs a medical supervision for intermittent fasting, or they can, follow it on their own as well with basic guidelines?
So there is another aspect I forgot to mention is pre-diabetes. Pre-diabetes is another group of patient in which we can actually reverse. Pre-diabetes is a reversible condition. So in these patients also intermittent fasting is quite good. Acha. The next part of the question is whether in obese patient or overweight patient we need medical supervision or not. For 12 to 12, we don't need any medical supervision. So, but 16 to 8, yes, because there can be some headache issues. Because there can be some hyperacidity issues as well, like the time at which patient usually takes their meal, say in the morning. If the patient is not taking the meal, they might have some little hyperacidity and a pain in the abdomen because of the increased acid secretion, which is because of the training which the patient has received for over the years. So with time it will reduce, but these patients might require some medical supervision. Other than that, there might be some irritability or headache during these exact times, and also sometimes with a stronger this intermittent fasting, like a stricter one that is 16/8 or even more, these patients might have a little bit of increased ghrelin secretion, which is a hunger hormone, and that can cause a huge amount of eating during those periods of the time when you're actually taking food. Now, another important aspect is these patients who are overweight or obese, they intermittent fasting means time restriction, no calorie restriction. But these patients should also go for some amount of calorie restriction, because in those period of eating, if they are overeating, then there is no point of, because they are taking in food which is going to be deposited in the liver and the fat. So we need to go for calorie restriction in these individuals as well. But in long term, obviously micronutrient deficiency can happen. There can be some issues, those who are having other comorbidities, so these patient needs to be followed up. Those who are on stricter intermittent fasting needs to be followed up closely, but those who are going for 12/12 can do it without any hiccups, I would
I
say.
think thank you so very much for highlighting this and building the confidence of the viewers here. Uh, are there any contraindications or are there any specific group of patients where you recommend that, look, if you have this situation and if you fall in this category, then you should never, try out this intermittent fasting. So please help us understand that as well.
First of all, pregnant individuals and nursing mothers. Calories should not be restricted. Intermittent fasting should not be prescribed in these individuals. They are at the point where they need to gain a little bit of weight, and they will reduce that weight later on if they try intermittent fasting after stopping nursing. So, intermittent fasting is a strict no for pregnant ladies and those who are lactating. Number one. Then second is children, infants and children. We have huge amount of childhood obesity as well. So that's something which is post COVID is increasing. So in these individuals, I would say calorie restriction will do, but not intermittent fasting, because they are very small and they have not been studied, right? And those who are suffering from psychiatric issues like anorexia, bulimia, they are the ones who should not go for intermittent fasting, because they have body image issues. So this can only aggravate, or they can cause problems. And obviously, diabetic individuals who are on oral hypoglycemics, who are on insulin, should not go without any doctor supervision. So these are roughly four situations where I would say it's contraindicated. Those who are suffering from CKD, like kidney disease or heart disease or liver disease, we should not go for liver disease, like all those who are in the failure stage, not those who are having a little bit of fatty liver. Those are ideal individuals in which you can go for intermittent fasting. But those who are having cirrhosis or major comorbidities also, I wouldn't suggest fasting in these individuals.
Okay. So you mentioned about children also they should not do, but there are a lot of adolescents, let's say, starting, or teenagers in the age of 16 to 24 in
16
the
is
early
okay.
20s.
16 is
Uh,
okay. Children, I would say that less than 12 is what I'm suggesting here. So, adolescent, they can go for intermittent fasting. 12 and 12 is something which is actually very easily followed. Even if we go home and look at our children also sleeps for 10, 12 hours, and possibly they are fasting at that point of time. So, 12 is very easy to do. But adolescent, yes, you can do, but not 16/8. 16/8 is not should not be done in adolescence also. 18 year
so I
old
think, yeah. So I think this will give a very good clarity to our viewers that who should do, how much you should be doing, and who should not do, and what are the age groups, and probably even in elderly patients, I'm sure you'll not
no.
recommend.
Yeah.
Okay.
Yeah. Elderly patient, if they are hale and hearty, 60 plus, okay. 70 plus, I won't say. So 60 plus hale and hearty, if we have now, because of good medical assistance and healthcare professionals, we have huge amount of elderly population in our country as well. So 60 plus is not considered as elderly population, though with all those connotations that all the definitions say that 65, 60 is in that
Yes.
category, but I don't consider them as elderly. They are adults. So 70 plus, I would say it's very difficult to maintain in intermittent fasting. But 60 hale and hearty, they can do if they are overweight and if they want to.
Okay, thanks for clarifying that. I just take a couple of last questions since we're also running out of time. You mentioned in your conversation also earlier about crash diets, dietitian telling. We all have heard about these things. Keto diet is still something very scientific, but crash diets are something which is very commonly you know talked about, and people will recommend. So, first of all, is it safe to have crash diets? It is sustainable in the long run.
No.
And then, secondly, how is this, so very different from intermittent fasting? And how, if you can just help us with that one more time.
First of all, crash diet is something, if it is suggested by our dietitians, we can follow for 1 month, but it's very difficult to follow, especially for working people. It's very difficult to follow. Secondly, it can cause micronutrient deficiency, it can cause other issues, starvation issues, ketosis issues. Patient may end up in hospital with starvation, ketosis. So, and most importantly, it's something that can be helped in induction but cannot be maintained, because obesity, as I mentioned earlier, is just like a thermostat. So if you stop your diet, if you stop your exercise, you go back to the same old weight that you were previously. So I would suggest something that is very easy to follow. The calorie restriction also, that is very easy to follow. So intermittent fasting is the best possible way of induction as well as maintaining. But regarding keto diet, this is intermittent fasting is actually an enhancement of keto diet. Keto diet means calorie from carbohydrate less is less, and high amount of fat, that is 70 to 80% of our energy is coming from fat. So this should also be medically supervised, because when fat is burned, we have ketone bodies in our blood, and this is itself reduces our hunger, number one. So with good amount of protein and good amount of fat, we get a reduction. The hunger pangs actually goes down, so we don't tend to eat a lot. And also because there is from sugar, there is we usually burn sugar. When we eat anything, we are burning sugar, but when we are eating a ketogenic diet, what we are doing is we are burning fat. So the insulin secretion also reduces. So these are the healthier aspects of ketogenic diet, but there are some safety concerns as well. We can have very like a strong fatigue, kind of, we call it keto flu, like a flu-like symptom, malaise, like we are not able to get up from bed. So these are side effects which is commonly found with keto diet. Then we can have constipation, muscle cramps, which are actually very commonly seen with crash diet, keto diet, and which is not actually very common with intermittent fasting. Though it's an enhancement of keto diet, but it's not commonly found in intermittent fasting. Along with that, we can have heart issues, we can have kidney issues because we are taking good amount of protein. So kidney issues can happen with keto diet, but with intermittent fasting, we are not going to have that. Also, we have seen that with a good reduction in BP, there is a good reduction in the cholesterol levels as well, especially the triglyceride levels. There is also an increase in the good cholesterol, that is the HDL cholesterol, with intermittent fasting. But with keto diet, there can be an alteration which is not good for the heart. So regarding keto diet, it's very difficult to maintain without medical supervision. But with intermittent fasting, it is easier to maintain. If we go for a 16 to 8 intermittent fasting, we should go for a regular follow up with the doctor, say every 3 months. But for 12 to 12-hour fasting, we don't need any regular follow up.
Sure, thank you. So here, our doctor tells us that be cautious on these keto diets and crash diets. Not really, recommended. What I could get up, take from what she said, but she still recommends intermittent fasting. One final question, ma'am, and that's on behavior. Our country is a country of foodies. There are people who live to eat basically, and who have gained weight, do a little more obese. I'm sure they are foodies by nature. So how do how do they keep themselves motivated, in your practice? Do you see some real time experiences where you recommend someone an intermittent diet, and how does an individual really motivates himself or herself, because there would be strong urges to eat, if you
Actually,
can.
I give my example. I started intermittent fasting after my second childbirth. So that is one of the living examples that I can give. So I have pictures in which I am kind of fat, and I reduced around 15 kgs with intermittent fasting. So I'm a living example of intermittent fasting. And I didn't go for a stricter one. I just went for a 12-hour fast. That is number one. So I am also a foodie. Coming from a Bengali family, we are we have the sweet tooth and we actually eat a lot. I usually say that we should go for moderation. So when we want to have something sweet, we can cut down on our carbohydrates a little so that it's evenly balanced. So moderation is something which is very, very essential. Even with intermittent fasting, or even with those individuals who are looking for a weight loss, I usually say that you should have some good options to snack in between. So we all know about breakfast, lunch, and dinner, what to take and what not to take. I usually give all my patient a plate method, in which I usually say that one fourth of your diet should contain carbohydrate, the half of your plate should be vegetables or fibers, and one fourth should be protein. So this is the plate method that I usually inform my patients. So that's for breakfast, lunch, and dinner. And in between, we should have healthier snacks. So whether it's milk products, if the patient can take milk, or the patient can take fruits in between, the patient can take chickpeas, sprouts. These are all good habits. So instead of taking a bar of chocolates, I would suggest that these are the better options. So I usually ask my patient to take something healthy so that the next meal, when the patient is taking the next meal, they are usually not that hungry. So the hunger pangs are quite less at that point of time. So this is how we can restrict our eating. And those who are actually those who know that they are very fat and they continue to eat a lot, there is a cheating method that I ask my patient to do, to take a glass of water before they take a major meal. So part of their tummy is already full. So that is a cheating method that I tell my patients, because it's very difficult, especially Indians. They take loads of carbohydrates. So if I tell my patient you take only 50 grams of carbohydrate, they are not going to follow. So I usually tell my patient, take 1 or 2 glasses of water prior to your meals. So your tummy will be a little full and you won't be eating a lot. So that is one of the good positive influence that the positive influence that I've been able to give my patient is an example of myself. So
So I think that these are some very, very interesting things which Dr. Vipsita has mentioned, how you can keep yourself motivated. But see, at the end of it, everyone should understand that obesity or being overweight is a problem. It can lead to various other problems in your body, and therefore there is a need to reduce weight. Now, one is like you go to a doctor and take all medicines, weight reduction medicines, and the other is like you apply these methods. One of these we discussed today as intermittent fasting, which can be helpful. And I think Dr. Ipsita today has really clarified this whole subject and helped all of us understand that how this can be followed and how you can motivate yourself as well. I must thank you, ma'am, for this wonderful deliberation today. I must thank all my viewers as well who joined us live or who would be watching this program later on. But before I conclude this program, I'll give it back, once again to Dr. Ipsita for in case she wants to make any final remarks or anything important which we missed, and she can answer this question also of one of our viewer, where it is asked that how long this should be continued. This can be continued intermittent. How many months, like this can be. So, final comments from you, ma'am.
So if I have to say how long we can continue, so if it's just 12 to 12 hours fast, I would say that you can continue lifetime because I'm still continuing that. I'm trying to continue that. So that's say around 4 years now. So that's something which is very safe, and 12 hours fast or 14 10 hours fast is actually quite safe. But if you are going for 16/8, especially for working ladies, it's going to be very difficult, because I think Mrs. Bhattacharya, I don't know whether you're working or not, but it becomes very laborious or very difficult if you're doing intermittent fasting and going out for your office. So in that situation, I'll say a 12 to 12 hour fast you can continue for months, years. I have continued for 4 years now. So, and if I have to conclude, I would say that it's one of the intermittent fasting is one of the easiest way to start on with your weight reduction program, because it's just a prolongation of your overnight fast by possibly 2 hours or 4 hours. Um, Here we are not talking about starvation. We are not talking about calorie restriction. It's just you're giving your body some amount of rest so that the metabolism be a little better, and your gut is at rest. So the good bacteria is working for you so that you don't have the chronic diseases. At least you can delay the progress of your or the start of your chronic disease like diabetes or obesity, because these good microbiomes or good bacteria that we have are one of the major reason we are having this. So periods of fasting is actually required. I would suggest that all my viewers should go for at least 12 to 12 hours fasting. So you'd eat for 12 hours, 12 hours you don't eat anything. So that is one of the best way of starting your lifestyle or continuing your lifestyle, because that is the only way that you can prevent the chronic disease other than stopping your addiction and increasing a little bit of exercise in your daily routine. So this is
Okay.
going to be my closing
Yeah.
remarks.
Thank you so very much, Dr. Ipsita, today coming over and really clarifying on this whole subject. There were so many questions which we keep on getting. I'm sure those curiosity pangs, at least of our viewers, would have got satisfied today, and you helped simplify the whole topic for us. If you are in, you need more information about it. You want to do this under medical supervision. You want more information, you can always meet Dr. Ipsita if you are in Kolkata or anywhere in Bengal. She is at EDF Hospital in Kolkata. If you are anywhere else watching us in some other city, do talk to your doctor about it, and preferably do it under medical supervision. Don't just do it if you have any underlying disease also. So take it with your advice of your doctor. So with this, I wish you all the very best to everyone, and thank all of you. And Dr. Ipsita, thanks to you as well. Good night.
Thank you.